Here's something you might not know. About 80% of the calls our Glendale firefighters run on here in the city are medical related. Every Glendale firefighter is a certified EMT, emergency medical technician. But as Stacy Lloyd tells us, many of our firefighters have a higher level of life-saving skills.
Mike Young and John Burch are Glendale firefighters and paramedics.
In the simplest terms, the difference between the two, I would have to say that a paramedic can break the skin. Paramedics, we can start IVs, we can give shots, different medicines. If somebody's not breathing, we can put a tube in their airway and breathe for them or assist them.
Both EMTs and paramedics provide what is called pre-hospital care. Just like it sounds, that's the life-saving care a patient receives before going to the hospital. Mike and John demonstrate. For starters, they open airways to help patients breathe.
I would place this into his mouth to help remove his tongue out of the way to be able to see in his airway. Once I'm able to see his airway, I would then place this tube into his airway. There's a small balloon here at the bottom of it. I would inflate that to keep it in place, and now we're able to control his airway and to breathe for the patient.
Here's what it's like when they're on a call where a patient has trouble breathing.
When we first arrive on scene, the paramedics are gathering the information as to what happened, why we're there, and we're thinking about the proper treatment process. While we're doing that, the EMTs are placing the patient on oxygen, putting the heart monitor on them, getting our vital signs for us so we can determine what's the best treatment for that patient.
EMTs are responsible for prepping the IV bag. This is a way to deliver fluid or medications directly into the vein so they can reach the patient's bloodstream. Paramedics then insert the needle into the patient's vein. Paramedics can also interpret the patient's heart rhythm by reading the heart monitor's tracing. That's the printout you see.
I'm looking at this rhythm. He's sinus tach at about 100.
We are able to take that heart tracing that we got and fax it to the hospital for an ER physician to also interpret it with us. And we're able to communicate with them on the way in to determine the proper treatment for that patient.
Glendale paramedics are also highly educated on the many different drugs they carry in their drug boxes. They can help everything from chest pain to allergic reactions and more. One reason Glendale firefighter paramedics are able to perform all of these life-saving skills is their training. They have 1,500 to 2,000 hours under their belt just to start, and they continue training every month. Having highly trained paramedics is just one more of the services offered by the Glendale Fire Department.
As a paramedic, because of our training, we're actually able to step up the level of treatment for the patient, which is obviously going to have a better outcome for them and help serve the community in a better way.
It enhances our department. It's great for the community to know that we're out there, that whenever they call, we got men and women trained to respond just like that and to give them the service that they need.
All Glendale firefighters have the option to become a paramedic. Currently, there are 122 paramedics in the Glendale Fire Department.